Taking all of these factors into consideration, there are 4 points of advice I want to highlight. The first is to reinforce that adults 18 years and above should be vaccinated, and we strongly advise that they are vaccinated. The benefits outweigh the potential harms. I am a chest physician. At the hospital that I work at, we are now seeing young people who are unvaccinated being admitted to hospital with quite severe COVID. Many of them need oxygen support, and sadly, some of them also need a ventilator machine to help them to breathe. Much of that suffering can be prevented or reduced through vaccination. And so my urge to adults who are 18 years and above who are not yet vaccinated is that you strongly consider booking your vaccine appointment, having the jab, and getting yourselves and your friends and family protected. That's the first piece of advice. The second relates to healthy 16 and 17-year-olds. We would like to advise that the first vaccine dose is offered now for 16 and 17-year-olds who are otherwise healthy, with the aim of a second vaccine dose to be offered sometime later. And we will provide another update of advice regarding the exact details of the second dose. The reason for wanting to provide advice on the second dose separately is because we're expecting more data to accumulate in the coming weeks. And that means that we can offer advice that is the most up-to-date and the most relevant for the second dose for this particular age group. I'd like to reflect that you may remember in the UK at the end of December last year, we chose to use a 2-dose schedule with an extended dose interval between the first and second dose. By doing so, that allowed us to prioritize first doses and have more people protected. We also know now that by extending the interval between the doses, we achieve a higher level of protection, which can translate into a longer duration of protection. With regard to the current advice, the extended dose interval means that we are in a position to offer advice on the first dose and still have time to look at new data as they accumulate before second doses are due. Other countries that have chosen to use a 3-week interval between their doses will not have this option quite so readily available to them. And that is maybe an important difference. This advice for healthy 16 and 17-year-olds is new and is in addition to the existing advice for 16 and 17-year-olds who have underlying health conditions that put them at risk of severe COVID. They have been eligible for vaccination for many months now, and I hope most of them have been vaccinated. The third point of advice is for children aged 12 to 15 years old. We offered advice for them last month in July, and that advice is unchanged at this time. Just to summarize, there are 2 groups of people in the age bracket 12 to 15 years who are advising vaccination for. These are people with specific underlying health conditions that put them at risk of severe COVID, and also 12 to 15-year-olds who are close household contacts of a person who is immunosuppressed. And this is because immunosuppressed persons may not be able to generate a good immune response even if they themselves are vaccinated. As I said, this advice is unchanged from July. The last and fourth piece of advice that I'd like to put forward today is I'd like to highlight the importance of other immunization programs that are routinely offered to children and young people, such as meningitis, human papillomavirus vaccines, and the influenza vaccine. As we increasingly return to life as normal, we need to catch up on these other vaccine programs as well. And so I would say that if you are eligible for one of these vaccines and are offered these vaccines, please do not ignore them just because we're in a pandemic. They are important and they are safe. Thank you.